By the United States of America, the republic for which it stands, a nation under God, indivisible, with liberty and justice for all.
You may be seated.
Good evening, Dr. Valdez. Good evening, Board of Trustees. At this point, we have no one sign up for open forum. Thank you again, Dr. Valdez. I just have a couple of things I want to share with our board members as our district continue with the rest of the state, with the rest of the country, trying to go and get everyone vaccinated. It's my pleasure to announce that about 90% of our staff is vaccinated, at least with the first shot. We still have more clinics that are happening. We were able to get through the partnership with the Hidalgo County Precinct 1, HEB, City of Donna, and also STC. I mean, we've been really working together, partnering with everyone really to help us get through this pandemic and somehow try to go back to that, have some sense of normalcy, right? Ensuring that our staff is vaccinated so they can work without worrying about their safety and security. So I have another quick video to acknowledge all our volunteers. We have clinics at Donna High School, a lot of our volunteers from Donna High School as well as from Donna North. This one is actually from Donna North, where we vaccinated more than 600 of our staff using the Pfizer vaccine, again, in collaboration with HEB. So I'm going to share with you a quick video again, just to acknowledge all their hard effort and work. Can you hear it? How are you? Doing good? Should be in and out, it should be quick. We're very thankful to, first of all, to the Hidalgo County and Precinct 1 and the City of Donna because we work together in several of our clinics already. But this is our first one with HEB, and we're very excited. This is their first big, my understanding is their first big mass kind of vaccination. All this will be for our staff. The good thing about taking the Pfizer vaccine is that the Pfizer has been approved for anyone who's 16 and older, so that can help our students eventually. Maybe we can open up for our students who are 16, 17, or 18, like junior and senior mainly, who will probably be able to have a chance to also get vaccinated with us and the partnership with HEB. So we're very excited about it.
When Donna ISD was approached and we let them know that we were very interested in partnering with them, they did have a need for many educators still lacking the vaccine. So we partnered up, we discussed information, got some details together. We were able to put together this clinic very short notice. And here we are immunizing roughly over 420 individuals.
I miss my students like crazy, and that's what we talk about almost daily. And my last class, right before I came this way, I ended up mentioning, I was like, yo, I'm gonna get my vaccine, I'm so excited. The majority of the students like, when is it our turn? Can we do it too? Like, we want to go back to class.
It's great, it's really convenient for us employees, not having the time, with coaching and whatnot to be out there looking and taking time away from our schedule to go look. It's here in Donna with our school district, and it's home. It's here.
It's incredibly gratifying as an immunizer being able to make this kind of an impact in people's lives. For a lot of people, this is a life-changing vaccine, right? So unfortunately, we have a lot of people who have been impacted heavily by this virus. They've lost loved ones. So seeing the relief, the instantaneous relief on their faces as we're sitting there and having a conversation, it's incredibly gratifying. I mean, I love what I do for a living. This profession is incredibly rewarding. I know that all of my partners feel that same way.
As a superintendent, the safety and security for our staff and our students, obviously it's my number one priority. I want to make sure they're safe, they're secure, they have the great working environment so they can really take care of our students, right? So the fact that we're providing vaccines for them, I think that will help put them at ease. And I'm hoping that eventually this will translate to more of our students coming back to face-to-face instruction, because we all know that is really the best way to learn, right? And so we miss our students, and our teachers miss, and our staff miss our students and interacting with them. And hopefully with everyone getting the vaccine, again, that will make us maybe slowly but surely eventually returning to normal. And again, I want to thank everyone, and I thank you, our board members, really, because without your support and help, obviously, we won't be able to get this partnership going. So thank you for your leadership. I want to just emphasize that we are working on getting the vaccine to our students who are 16 and older. As you know, Pfizer already did some trial on students who are 12 and older. And so there is a high chance that they may get what's called emergency authorization, so they can actually start providing these vaccines to students who are 12 all the way to 16, because they're already approved for 16 and older. So our goal, our hope is really to get as many of our students who will qualify, right? Once the CDC and FDA said that they can, and then we're going to continue this partnership so we can provide Pfizer's to our students. So again, our goal is, thanks to you board members for your support, is to again make sure that our staff, as well as any students who qualify, to get the vaccine as soon as possible.
Thank you, Dr. Azzi. That was an excellent video. Thank you for sharing. Item number 2, April LSG monitoring report for Gold 2.
So forgive me, Dr. Valdez, I forgot to mention, I had another thing I want to discuss with you prior and under my highlights. So it's my apologies for not
I'm
sharing that
sorry.
with you. No, my apologies. So we had actually one of our partners who helped us with tax collection, and they have a very good news to share with us. Because as you know, because of pandemic, a lot of school districts were not able to collect taxes, and as you know, we use those taxes to operate, right? To pay for our bills, but as well as our staff salaries, etc. So Dr. Miscancino is here with us, and she has somebody from our organization that helps us with that. I see Ms. Cancino. I cannot hear Ms. Cancino, so maybe.
Maybe she's muted,
Yeah,
because I do see her there.
we have somebody from Limburger with us, right? So he's going to be presenting, and I think that's Mr. Cano.
That is correct. Thank you, Doctor.
Okay.
Good evening, everyone. This is Michael Cano with Linebarger. Doctor is correct in that I do have some good news. A lot of the neighboring districts have been lagging behind some of their delinquent tax collections. But here in the community of Donna, we've been doing very well. And I don't want to go through all the details in the report. You do have, or you should have, our report in your packet that gives all the details of all the phone calls we've made and visits. And obviously, we've made a lot of changes because of the pandemic. We've deferred a lot of our litigation. We've changed the way we approach people. We've obviously deferred payment agreements. But in the end, I think the analogy that says you catch more bees with honey than you do with vinegar actually works. Because in working with people, being a little bit more lenient with them, understanding the times, people have actually come through They've paid their payment arrangements, and they've made their monthly payments. And as you can see on page 4 of our report, for the first 6 months of this fiscal year, which obviously runs September through February, in 6 months, we collected just over $984,000 just in delinquent taxes for the district. Now, what we always do is we always benchmark to the same period for the prior year so we can monitor our progress. And the prior year, you'll see that chart or that comparison, we collected $690,000. So we're about $300,000 up this year for the first 6 months than we were from the prior year. Now, again, and I want to put this in kind of bigger perspective because obviously that last fiscal year was affected by, obviously the pandemic. But basically this year, the first 6 months, we have also exceeded by far the collections of the previous year to that. So I know that we're doing extremely well. So now if you look at the collections for March, which we received after we put this presentation together, instead of being up $300,000, we're actually up $419,000 through the end of March. So we've actually increased that gap, if that makes any sense. And I know you should also have a copy of the current collection report from Mr. Fabiariel's office. And I just want you to know that on the current side, the district is also up $876,000. So when you look at your current collections being up, almost $900,000, your delinquent taxes are up, over $400,000. I just want you to know from the tax side, the property tax side of the district's operations, y'all are in incredible shape. I think it says a lot about the resiliency of your community, your taxpayers. And I've always believed that when your taxpayers and constituents believe in your program, it makes our job a lot easier because it makes it easier for people to pay into the system. And I think that speaks volumes of the leadership of Donna because, again, when the taxpayers see that their money's being well cared for and it's going to good use, it makes our job a lot easier. So again, I'm very proud of the efforts that, not me, myself, but really our staff. We have 50 people that come to work every day that work on behalf of the Donna ISD. And I couldn't be more proud of the work, especially considering the pandemic. So again, thank you, Doctor, for that segue. It's always nice to deliver good news, especially during these uncertain times. Again, just want to reassure the board that we are working very diligently. We're having great success this year despite the pandemic. And it is my hope to come back at the end of this fiscal year and hopefully report a record year during a pandemic, which would just be phenomenal. So hopefully we can get that done.
Thank you, Dr. Cano. Thank you.
Anybody have any questions? I'll be more than happy to answer them.
Okay, we can go ahead and move on to item number 2 now, April LSG monitoring report, Dr. Azzi.
Thank you. Thank you, Dr. Valdez again. So yes, I'm gonna just share my screen again one more time. There we go. Oh, let's see. So April monitoring report, we're gonna be talking about board goal 2, which is really talks about reading. So let me just a quick review. What is goal number 2? It's really talking about our percentage of 3rd grade students that meet or exceed grade level and the STAR test. And we want that to increase, obviously, from 32 to 41% by year 2025. Under goal 3, under goal 2, we have 3 GPMs. GPM 2.1 is looking at the 2nd grade reading scores, and we want that score to increase from 40 to 70% by year 2025. GPM 2.2 looking at 1st grade students reading at above grade level. We want that to increase from 31 to 70% by year 2025. And GPM 2.3, we want the percentage of kindergarten students reading our above grade level to go from 69 to 80% by year 2025. This is pretty much a quick summary of just a table to talk about that stuff. The yearly goals, as you can see, from one year to another. And so for this year, obviously 2021, we want that goal 2 to be at 32%. And you can see for GPM 2.1 is at 40, GPM 2.2 as 31%, and then GPM 2.3 as 69%. So then you can see also we have to set up for different subpopulations or groups, if you will, different sort of groups. And we can see that they also have certain goals for our Hispanic students, for our ECODISC, for EL, and for our special needs students. And again, you can see we have goals for every year. Looking at goal number 2, and you can see that we are monitoring this quarterly. And so in quarter 3, which is the it went from January to February. That's when we finished testing the students. You can see that for overall students, we have 25% of our students who are meeting the goal, and our annual goal, which is the end of the year goal, is at 32%. So we are at 25% overall, and you can also see a breakdown for every student population here. Here, when you look at every GPM, and now we go into grade 2 or second grade, and you can see that our goal for GPM 2.1 is 40%. And as you can see, our students overall, based on quartile 3, they already exceeded that goal. So we are at 43% overall, and 43% for our Hispanic students, 43% for our EcoDisc, 34% for our EL students, and 25% for our SPED students. So our teachers and our students are working extremely hard to ensure again that in this case, second grade students are meeting the goal. Looking at GPM 2.2, and this is again reading for first grade. As you can see, that our students in quartile 3, they are 48% all students, 48% for Hispanic, 48% for EcoDisc, 44% for EL, and 34% for our special education students. And you can see the next column, it shows exactly our goals. And again, it's obvious that our students and our teachers are doing a great job helping our students achieve those goals. The last one, GPM 2.3, concentrates mainly on our kindergarten students. And you can see for quartile 3, our students are at 62% meet or exceed the reading level, 63% for our Hispanic students, 62% for EcoDisc, 57% for our English learners, and 61% for our special education. And again, they are not necessarily meeting all our goals, only for, I think, for our special ed students, we're exceeding that goal. For the rest, we are approaching, but we're not there. We have some more work to be done at the kindergarten level. So due to the pandemic, there was goal presentation. Therefore, there's no comparison available when we have. Let me just talk about some of the stuff that our teachers and our staff have been engaged in doing. As I don't know if you know, but we do have a literacy plan, and that literacy plan has been updated regularly. We have a literacy committee led by Ms. Vela, and so she's been working with committee members, and they've been trying to figure out how to improve our literacy plan, how to ensure again our students are doing better job when it comes to literacy. So that's including explicit reading and writing instruction strategies. All our kinder teachers, campus administrators, central office staff, as you know, they'll be enrolled in the reading academies. Those are academies that will happen over several days of training. There's also some coaching attached with it. That really was an initiative that started with House Bill 3 back in 2019, that now TEA is leading the work when it comes to implementation of these reading academies. And the goal is to make lower grade teachers better reading teachers. So this is some, again, one of the things that we are doing as far as next step. And we feel like we're not meeting the goal yet. Obviously, we still have some work to do, but we feel like we are approaching the goal that we set for the end of this school year. Just a reminder that how obviously we don't have a start test like happening. I mean, we barely started doing some writing test for our 4th, 7th grade, and also for English 1 and English 2 students. So we are being using Imagine Learning Galileo system, which is an online computer system that will allow us to measure students' reading levels, as well as providing some intervention and help with them. For our Spanish reading students, obviously, we have to use a different program because Imagine Learning Galileo, they don't have the Spanish version yet. So we use an iStation because that does provide the Spanish version. So those are the two methods we've been using really to get this data. I want to also recognize, as you saw in the presentation, some of our schools and students are doing a phenomenal job. All of them are working very hard, but some of them are really exceeding or achieving that goal. So I want to congratulate all our second grade students and teachers who have already exceeded their board target for this year for all student Hispanic, economic disadvantage, and special education. And these are the four campuses. They are really their scores is really like the top four. So Adami, Lenore, Ochoa, and Salinas are really leading the way when it comes to second grade scores. So I want to congratulate them, their teachers, and our students and parents for really working hard to ensure again that our students are, improving and increasing their reading proficiencies. And that's what I have, Dr. Valdez. I don't know if anybody have any questions or comments.
Questions, anybody? No? Dr. Tracy, I just have one question. The literacy, is that inclusive of students that are online virtually
Yes.
and the ones that are at school both?
Yes, so thank you. That's a very good question, Dr. Valdez. Yes, so this data is for our students who are on face-to-face, and we do have almost 25% of our students are face-to-face, and also the ones who are virtual doing it from home.
Okay, all right. Thank you, sir. At this time, we accept or reject the report. Mr. Castillo? Colonel? Mr. Valdez? Mrs. Watts? Mr. Reyna? I also accept. Okay, moving on to item number 3, update on self-funded health insurance plan.
Thank you, Dr. Valdez. And we wanted to provide some updates, our self-funded health insurance plan, because we also have to start thinking about next school year and coming up with plans for that. So with us today, we have Dr. Sorolla, and I know that he also invited our consultant, which is the Gallagher, right? He's our consultant company, and we have a representative from the company. Mr. Arias, right? He's with us, FC.
Correct. So did you want me to start, or was Dr. Sorolla going to
Yes,
say?
sir. Yes, sir. Thank you, Mr. Arias. And I'll go ahead and defer to you. Thank you for helping us today. I believe you shared your presentation, and I think you should be able to share your screen.
Yes, let me. Are you able to see my screen? Okay.
Yes, sir.
So there is, Madam President, members of the board, Superintendent AZ. My name is Lou Arias. I'm with Gallagher Benefit Services, which is your consulting firm for the self-insured insurance program at Donna ISD. What you're looking at is a slide presentation that I'm going to go through. There are some sections there that I've been made aware that are very small. And so if you cannot see the graph portions or the spreadsheets, let me know, and I'll quickly shift over to a PDF file that I can enlarge. And we'll just flick back and forth. It's only for the first like 4 or 5 screens, and I apologize. I'll make corrections to that the next time and just summarize it as opposed to using the graphs. They're a little hard on the eyes. But as Dr. Az mentioned, we are at that time of year where we need to start looking at what we're going to do for the next plan year. And so we've already started the ball in motion with some cost projections. We won't look at those here today because I need to finalize those, as well as in speaking with Blue Cross Blue Shield on plan selections. What I did want to make you aware of is the status of the health fund with claims through February. And if you recall, the last time I presented had claims through, I believe, the end of the year, and we did October, and we did a recap. And so I'm going to go ahead and get started on that because we do have a lot of information to go through. And so I'm going to go through the financial monitor report with claims through February. I'll go through the Blue Cross Blue Shield Insight report briefly to show some graphs and some numbers that'll coincide with the numbers that I'm going to show you on the monitor report. I'm also going to bring your attention to the pharmacy, which is with ESI, some reporting that also has claims through February of 21. I have some Blue Cross COVID reporting that I think is going to be extremely important as you start to see some of these numbers. And then we'll talk about some next steps, speaking to what do we do for the next plan year. And I have several options or recommendations that we probably need to discuss. Is this too small or can everybody see that? No, too small?
Yeah, Mr. Arias, I was the one that had emailed you because I don't know if maybe you can use some type of a program because I wear glasses and the print is very small. I'm having to strain myself to see the numbers. I don't know if I'm the only one that has issues with it.
I apologize.
They have a hard time, like, they're really small.
All right, I can give you the information. I did share the PDF file that could be enlarged, or I can shift over to that PDF file if you think that'll help.
Why don't you shift? Let's take a look and see what
Sure.
it's like.
Let me do that.
Because it's the same information, right, on both?
It is. It's just not going to have some of my notes in the side, but I can tell you what those are.
No, I think last time the way you did it is you did a summation of the reporting we provided back in last year. So at the last quarter that you provided an update. So I think that was just right instead of going through the whole screen.
Okay, I'll tell you what. Then I'll do a summation. I sent the PDF, and you can look at the detail. And next time, I'll just do a summation on the slides. So the summation would be that we have claims through February. There's a 30-day lag. And we started, if you recall, we started your plan year early. We moved it back to September 1 because the first year that we came on board and did the RFP, we needed an additional 30 days to get the implementation to move from UHC to Blue Cross. So it was a 10-1. And so this will show claims starting in September. So going through September through February 21, the month of February was a very bad month. You got hit very hard on the month of February, as well as December. And I will go over some detail that'll be easier to see. But year to date, all plans combined, the budgeted cost, or what we have budgeted, is $7.7 million. But what has actually been spent is 9.7. So we're about a 1.9 million deficit for the first 6 months. The first 6 months of claims, every single month was a deficit. But by far, we had a spike in December and mostly in February. If we look at where we were last year, year to date, we were at 8.1 million. So we're about $1.5 million higher than we were last year, our first year with Blue Cross.
Mr. Arias, I don't mean to interrupt you, but can you go into presentation mode so we can just see the screen? Maybe it'll enlarge it a little bit.
Oh, I apologize. I thought I was. Yeah, you're correct. Does that help? A little bit?
Some. I'll enlarge it over here where I'm at.
Okay.
Okay.
Okay. So I'll go, that's all plans together. If we just look at your medium plan, which is where the majority of your folks are enrolled. Again, if you look at February, it's 258. I'm sorry, the plan cost was 1.6 million. Through February, what was budgeted was, through February, year to date, we're at 8.1 million. Last year to date, we were at 5.8. This is where the majority of your folks are on the plan. And so we have a $2.3 million difference on the medium plan. And I will show you where some of these claims are coming from, but the majority of those are from the medium plan because that is where the biggest headcount is. So 55% of that cost is for medical expenses. 27% of that cost is pharmacy. I will show you some pharmacy numbers. Those pharmacy numbers are high. And I'll tell you what we're doing to help offset that. 6% of your costs, this is important to remember, 6% of your costs are your admin fees. And so that's what you pay Blue Cross Blue Shield to administer your program. It's the amount that's not an actual claim. And then 12% is your stop loss premium. Again, the amount that's not an actual claim, it's the insurance that you pay for anything over the individual stop loss level. So your total plan cost for the medium plan is $8.1 million, which I had mentioned on the previous slide. If we look at your high plan, this is the plan that has the lower deductible, the $3,000 deductible. So folks who are on this plan are actually paying more out of their pocket to be on this particular plan in exchange for that lower deductible. Year to date, we're at 1.5 million through February. If we look at a snapshot of last year, we were at 1.3 million. So the difference is about $200,000 more than last year. Not as many folks on this plan. The utilization isn't as high as it would be on the medium plan. Again, that's because the majority of the folks are on the medium plan. If we look at the breakdown of those claims, 49% of that is medical expenses. However, even though that medium plan isn't running as badly as the high plan, the high plan isn't running as bad as the medium plan. 38% is a big chunk for pharmacy on one plan. And again, we'll discuss and I'll show you some numbers as to why that is 38% and what we're planning on doing to help offset that. Again, 4% of it's ASO fees, 9% is stop loss. Again, 1.5 million through February. Here are your large cost claimants. So when I brought up your stop loss, Donna picks up the first $300,000 of risk on each individual. And then once that person hits that, Donna's no longer at risk for those claims. The stop loss, that's what you pay the premiums for, starts reimbursing those claims back to the district. And so you have, we start tracking your high cost claimants at half of the ISL. So in this case, 150,000. So through February, you had two people or two claimants that hit that $300,000 threshold. And you can see the expected reimbursement amounts on the right here is what's being reimbursed back to Donna once that claim is being paid. And then you've got two others that are getting 217 is getting close to that threshold, and then a fourth that's at about half, a little over half. If you look below that, you'll see the breakup of the relationship. So we have a spouse, some dependent children, and two subscribers. And if you look at the age ranges, they're noted there. They're the diagnosis of the nervous system and sense organs, infectious parasitic diseases, that can encompass COVID. And certain conditions pertaining to perinatal period, you have some premature babies that were born twins that have run up quite a bit in the hospital, and preemies can be expensive. Again, I think having said that, those are, when you talk about COVID and premature babies, those are kind of things that you really can't foresee or predict. They just kind of happen. And so you have two large high cost claimants that have hit the ISL level. What we want to look at here is you are running at 99.3% of your aggregate. If you recall, the first year we funded to the max because we needed to make sure that we didn't have any liability out there and that insurance would cover everything. And in exchange, in an attempt to keep the rates, the deductions for the employees and the contribution for the district the same, we had to make those drastic changes to the plans. The second year we funded to the expected claims, what Blue Cross, because they won the stop loss bid and they gave us what their expected claims would be based on the information and what the maximum was. And so two decisions were made. One, we didn't think we needed to fund to the max on year two, even though we were in a pandemic, because some of those costs were going to be offset by some of the non-scheduled, postponed, non-essential claims. The other thing, quite frankly, is, if you recall, the discussion was also a financial decision. We simply could not continue to fund to the max because it was going to be, I think, in the area of like 20%. And so we were comfortable in showing the information, and the decision was made to go ahead and just fund to expected, keeping the rates the same for employees, the contribution the same for the district. Now, this is only 6 months worth of information. There's still time. You got 6 more months to see this start to drop off. And that's what we're hoping will happen. Like I said, you did have the premature babies, which again, it's just unavoidable, but you did have some COVID claims. And I'm sure staff is aware of some of those COVID claims. And we did unfortunately have some of the members that did expire and pass away due to COVID. So some of that risk we won't see any longer. But as a whole, when I start showing you some of this reporting, it wasn't just those two people. You did quite have a high amount of COVID folks or prevalence for COVID. And so as I go through this slide here, this comes off of the Blue Cross reporting engine. This shows February. I won't go through every single column, but I'll give you a summation. This shows February of 2021. And the reason I put this up here is because the reason we made the decision during the RFP to move you from UHC to Blue Cross is, remember, you're not paying premiums, you're self-funded, you're paying claims. So we wanted to make sure that you got the carrier that had the biggest discount. In other words, who pays the least amount of money for those premature babies? United Healthcare, Aetna, Blue Cross. And when we did this during RFP, Blue Cross by far was the leader as far as the discounts go. And so what they do is they show us monthly what the bill charges are. So here you're looking at 6.4 million. But when you start looking at these discounted amounts, they discounted that by 4.7 million. If you look at the charts over here, the blue part is what was actually paid. This big light green section is the discounted amount. So yes, I know that when we're looking at those numbers that were higher than we were last year, but we are still in the right place. We have the right carrier that pays the least amount for these particular services. If I recall, I pulled up some numbers before getting on UHC. If we would have continued, it was $7 million more their renewal. So they don't have nearly as deep of a discount as Blue Cross. And it doesn't surprise me because Blue Cross does very well in some of the non-major service areas. So I wanted to make sure you guys saw this slide as far as the discount goes. And then over here, this is just your fees and credits. So when we're looking at the actual claim dollars, your fees are a significant amount, but they're a very small piece of the total amount paid. I break it down here by in-network and inpatient and outpatient. So if you look at the first part, it says Medicare primary indicator, which means that this is not Medicare coordinating benefits. This is all Donna ISD. You have some inpatient facility, the amount covered. Look at the amount discounted, 76.7%. On outpatient, 77%, your professional fees, 60.8%, getting about an average of 71.9% on the discount off the billed charges. We get emails from Blue Cross saying, hey, you have a high cost claimant, and they give us the actual billed charges. But I try not to focus on that billed charges because we already know that that claim is going to be reduced to, it's going to be 70% after they actually bill it. The other section here does the same thing. This only shows that if there's somebody who has Medicare, we want to make sure that there's a coordination of benefit, because there are some instances where Medicare becomes primary and the district would pay secondary. There aren't that many here. So we do show those dollar amounts here. And again, look at the amount that was billed, the amount discounted, and versus the amount that was actually paid. So this does show that Blue Cross does have a pretty hefty discount on the claims. This is the slide where I think it's going to talk to you a lot about what's going on when we look at those numbers from November and February. If you look at that top line, these are your leading diagnostic categories by cost. COVID, infectious parasitic, that is COVID. The light blue line was last September of 2019 through 20 in comparison to September 20 of 21. I mean, it goes all the way off to the other side of the page. Then right below that, I mentioned the premature babies. They're right below that. So things below this line are what we normally would see outside of COVID in a preemie that really can't be, predicted. And so this paints a picture of that February month where those claims and that November spike, these two were the culprits. Now, again, we've got 6 more months, so we're hoping to see some of that risk start to disappear. And as more and more people get vaccinated, that risk will start to disappear. So I'm glad to hear that the district is doing its job in getting as many teachers and kids vaccinated so that we're not, we're playing, a lot safer than we were before the vaccine was even around, or before we even knew what the CDC rules were going to be. But this does tell a pretty telling picture on that February claim spike. I'm going to switch over to pharmacy because I noticed that on the pharmacy side, if you call the 27% and the 38%, the pharmacy spend for Donna ISD is unusually high. Now, we knew it was going to be unusually high on your specialty drugs. If you recall, last, I think it was October or November, we approved, the board gave us permission to move to 3 different programs. One was called Save on SP, which used manufacturing coupons to help offset the cost of specialty drugs. The other one was called the AUM and the Safeguard programs, which targets diabetes and pulmonary conditions. Those went into effect February 1st. So what you're looking at here, those programs haven't had a chance to mature. We're not starting to see the impact of those, but within the next quarter, you will start to see the impact of those programs. If we look at diabetes, we've known for at least 2 years that I've been here that diabetes has been your top indicator, 21.2%. And then you have your inflammatory conditions. Those are medications that like Humira, Enbrel that you see on TV. Inflammatory conditions are very expensive. That also falls within that category of specialty drugs. And then, of course, we have the other drugs, cancer, your HIVs, MS. Vaccinations, even though there was a lot of COVID vaccinations, they're not that expensive. But there is a little bit of a spike, obviously, due to COVID in comparison. But if we look here versus your non-specialty and specialty, we do have a good amount of specialty drugs that we're hoping those programs that we implemented on 2/1 will make an impact. But what's interesting is your non-specialty spend. If we look at your generic fill rate, it's 82.9%. And the reason that's interesting is because on your mail order for these diabetic medications, which are chronic, so they go through mail order and they get 90 days at a time, the generic copay is 0. Members wouldn't pay anything for them. However, the members do have a choice of getting the brand name specialty drugs. And so even though the cost is 0 to the members, there's a good number of those that are still choosing to take the brand name specialty drug. 83% is low under normal conditions, but it's extremely, this should be way higher given that we have a 0 copay program. So we need to start a educational campaign to employees, letting them know that there is a lower cost alternative. But quite frankly, you are going to have some employees that say they understand that there's a lower cost alternative, but they and their doctor choose to use the brand name. And so we're trying to be very sensitive to not trying to dictate what they can and cannot take, but we also have to be sensitive to the cost of those drugs. And so I thought that this was interesting on the generic fill rate. If we look at your key statistics on specialty dialed in, again, these are your specialty drugs. Your specialty plan cost is $7 higher than your peer. Your peer is the other school districts that are in the collective with ESI. And you have 28 unique specialty patients, which is an increase of 9 over last year. So you have 9 more folks taking specialty drugs this year than you had last year. Again, we haven't seen the impact of those new programs, the Smart 90 will have on these. It's targeting specialty drugs specifically. So I'll be curious to see the next quarter of it, what impact that makes. When we ran the models, putting in the Smart 90, the Save on SP, the AUM, and the Safeguard programs, the projection was $400,000 in savings. But we just started this thing in February, so we haven't seen that yet. Again, your top 10 indications, your largest financially impactful change is diabetes. And we've known that for a while, right? Diabetes, which is why you also, if you recall, you guys have a diabetic supply benefit with a local vendor where they can go at no cost to make sure that they go, because we don't want cost to be a reason for them not to be a participant in their healthcare. We're looking at generic fill rate. Again, we want to see that generic fill rate increase. And if you look at these here, diabetes and inflammatory conditions, those are your most expensive drugs. They're almost all specialty drugs as far as what Donna's utilizing. And here are the names of those specialty drugs. So for diabetes, you got Trulicity. if you go onto the Walgreens or CVS websites and you type in the cost, make sure you type in the cost without insurance, because if you put in cost with insurance, it's going to give you like a $20 or $30 copay. That's what the members pay. But the cost of the drug is actually close to $1,000. And if you've got 287 of them at $1,000 a piece times 12 months, it's a lot of money. These drugs are very expensive. Cystic fibrosis, another Trikafta, is also a specialty drug. Enbrel, specialty drug. Jardiance. So a lot of these drugs, we have some formulary alternatives that we need to do a really good job of educating the members. But like I said, it becomes the member's choice. And I'll talk a little bit about what we can do to change that if, in fact, Donna wants to go down that road. Here are your top 21 specialty drugs only. Again, there's your trifecta, your Enbrels. These are Humira. These are your specialty drugs. That program that we implemented, these are the drugs that have those manufacturing coupons. We should start to see these start to trend downward after this first quarter. So just quick in summation on pharmacy, your plan cost increased by 31.3%. 1.8 million to 2.3. Your generic fill rate decreased. We need to do a better job, but even 83 is we need to see that up in the 90s, especially since you have a $0 generic program. Your specialty drugs, those very expensive drugs we just finished talking about, account for 31.2% of your pharmacy costs. And again, your clinical drivers, we talked about that, the diabetes, the inflammatory conditions. You have an HIV that's going to stay on there. And then some of these other Trulicity, Trifecta, Penzic accounted for about $421,000 in pharmacy spend. So let's look at COVID real quick, because remember I told you we saw that blue line that stretched across the page, and we looked at those 2 months that you got hit really hard. Here's your dashboard. This is provided by Blue Cross Blue Shield. Keep in mind, these numbers account for those who were treated, diagnosed, through the medical plan. This does not include those members that may have gone out into the community to get their vaccinations or their testing. And so here's the benchmark. The prevalence for the state is 4.3%. The national prevalence is 6.10. But at Donna, the prevalence was 13.8. So we all know, and especially you all, that the Valley was a hotspot back in July over the summer. And then again, there was a spike in the fall. And so this doesn't surprise me. It does surprise me that it is double digit. But the Valley was a hotspot. And so we had 465 that came in and were diagnosed. You had 1,000, just under 1,100 members that were tested, 22.5% tested positive. Here's your year-to-date total paid, just under $1 million. And it was $33,000 per person for inpatient, any inpatient days that they were in the hospital. Here's your outpatient, here's your professional. So you did have folks that ended up in the hospital. They didn't just get COVID and, went to the doctor, got some medication. You had a good number of them that ended up in the hospital. And so I just wanted to reiterate, those 361 of them were employees. The actual subscriber, you had 23 spouses and 80 dependents, and then one potential that wasn't confirmed. Here's a calendar. They started tracking COVID. If you look at last July, is where it really started to spike. We look at September, it started to flatten out a little bit, but then November and absolutely in February, which goes with the slide that I showed you where February we had a deficit of about $600,000. And so a good chunk of that was COVID in addition to the preemies that we saw. And this just reiterates the prevalence at Donna was 13.8 versus the state benchmark and the national benchmark. This just breaks it down by demographics, male and female, and then the age group. And it's not surprising that, the further to the right are the ones that are the most at risk. I mean, we see that all the time, which is why they gave preference to those, higher in age to get the vaccine first. Again, just a quick testing overview. Again, if you look at July last year, here's November. through December. This kind of just reiterates 22.5% of the members of the 1,100 members tested positive. This is kind of overkill here. Same thing, inpatient, 33,000, outpatient and professional services. It's another dashboard. I probably didn't need to put this one in. It's identical. Here's an interesting slide that maybe a lot of people aren't talking about, is the behavioral health side of it. Not just the COVID itself, but the impact of virtual learning, working from home, remote working, being furloughed. All of that stuff comes into play. We're meant to be outside socializing. A lot of families are spending a lot more time indoors in small quarters with other family members, and it's harder to deal with stuff. And so we are seeing the behavioral side of the services also starting to increase. And you can break it down by number one was mood disorders, factors influencing healthcare, and anxiety, lots of anxiety. And if you can see where these actually kind of match the graph as to what months were hit the hardest. And then here's the breakdown of whether it was medical, professional, psychiatric, and then outpatient. And so we wanted to make sure that we saw this. And the reason I'm bringing this up also is you guys have telemedicine. The decision was made. Normally, behavioral services are not included in telemedicine. It's just basically primary care. But we added behavioral services to the telemedicine availability so that folks could not leave their home and go to a doctor's office and receive that type of care if it wasn't, if it didn't require being seen by an actual physician. And so the decision was also made to continue down that path and allow your employees to continue to seek behavioral health via the telemedicine benefit. It doesn't mean that you're paying for stuff that you wouldn't have already paid for before. You would have paid for that. Even if we didn't include it in telemedicine, you're just making it a lot easier on our employees to ease some of that anxiety. But I think a lot of people don't look at the behavioral health impact as they're constantly kind of looking at the COVID, the disease itself. So let's talk about next steps. So we start beginning on cost projections. I actually have those. They're being peer reviewed. I want to make sure they're correct before I show those to Mr. Rivera. I told him that today. We need to determine plan changes and contribution changes. I will model those out similarly like I did last year. We're doing it a lot earlier this year. But I will show you what those look like, because if you recall, you heard me say, I think the impact to last year over this year to stay at expected claims, it was like a 3.8% increase. It equated to about $421,000. And we went ahead and we chose to just keep everything the same and take the chance that we would come in and not be over those 421 to expected, knowing that we could still go all the way to the max. I think because of the COVID and some of this stuff on here and the pharmacy trends we're seeing, it's probably going to be more than that 3.5%. Trend itself is running at about 10%. And so I'm looking at plan changes to offset any increase by the district or any increase to the employees. But I also don't want to strip this plan down. We already did that. We have a $3,000 and $5,000 deductible. I don't want to strip this thing down. So I'm working with Blue Cross currently on some other plan designs. And we'll show those to Donna. Jose's forming a committee that will include folks from every department, including some of the transportation and cafeteria custodial staffs, because they need to have a say and understand this as well, so that we can start educating on, if we start making plan changes, they need to understand what those changes are and how that works, and then go down that route to determine ultimately what ends up happening. The stop loss will always go out to bid. That's the one thing that goes to bid every year because it's the insurance piece. And so we'll put that out probably around June, maybe May. You don't want to go out too early because then your carriers will be very conservative because they have to predict out a lot further out into the future. Now, as I was talking about all this, Mr. Rivera and Dr. Sorolla had mentioned, well, what do we do? I mean, do we bid this thing? Keep in mind, we've completed 1 full year with Blue Cross. We're in our second year. We're 6 months into our second year of a 3-year contract. We also just implemented some programs to help offset the specialty drug spend that just started in February. We can continue down the road and let this play out and finish the second year and then determine whether you want to start a third year, because after 3 years, we'd have to bid it out anyway, or we can bid it now. And if we decide we're going to bid it, I mean, we literally have to put this thing out now. Now, my thoughts on that, and I want to be careful how I word this because I don't want to show any kind of favoritism to any one carrier over the other. But my thoughts on that is that we've looking at other RFPs in the area, we've already seen time and time again, Blue Cross has just been extremely aggressive on their fees, which are a smaller amount. Remember, they were only 6% of the cost, but they have the largest discount that we can see so far. You know, upwards of 70, what was it, 71%, 77 on inpatient, 75 on outpatient. We can go through the process of bidding this, but I feel like we'll end up right back with Blue Cross anyway, and the claim dollars are not going to change. It's the same contract. What might potentially change are the fees. We might get a better deal on the fees. Keep in mind, they gave us a huge $400,000 admin credit on year one. I don't know that they would do that if we did this again because we didn't finish the term, but we could probably get a better deal on the fees. But remember, the fees are 6%. Not that that's not significant. I mean, money's money. But my feelings are that we would end up with the exact same two carriers on the pharmacy, on the PBM, and on the medical. I'm not saying we shouldn't do it, but I think we need to think about possibly just letting it ride through with the current carrier under the current arrangement and let these programs hopefully offset that cost. So we'll need to make that decision, and we need to make it pretty quickly. We're going to monitor those savings on the Save on SP. That's the program that the board agreed to implement that started February 1st to help offset that specialty drug spend. And then like I said, I've been talking to Mr. Rivera almost weekly since November, and he's gearing up, getting an insurance committee together, whether we go out to bid or not. Even if we don't go out to bid, we still need to talk to the committee about plan changes, and they need to understand it and understand the difference between your current EPO plan and, let's say, an HMO or a narrow network arrangement. And so just real quick, because I know I've taken up a lot of your time, but a lot of these changes, just to kind of give you as to what's to come, are going to require a little bit of pain in that we don't want to strip the plans anymore. I think we can all agree on that. We want to keep the cost about the same, minimal increases to both the district and the employees. So the next thing we need to look at is tightening up the formulary. You know, I mentioned that you have a $0 generic, but the employees still have a option, a choice that they could go the other route without any kind of, penalty per se. We might need to look at what if we get, if they chose to get the brand, even when there was a generic available and it was $0 and much less expensive, do the employees pay a little bit more for that choice, or do we not allow it at all? Again, we have to be very careful and sensitive because, folks that have been taking these medicines are going to say, but I've been taking this forever and the generic isn't equivalent. Same thing on the networks. We don't want to strip or increase deductibles. What we can do is start to look at what other providers does Blue Cross have in that area that have even deeper discounts and narrow that network even more, but not to the point where the employees don't have any choices. And that's what these committees are going to be formed to do so that they can have input and they can see how this is going to work. That concludes my presentation, unless you guys, I'm sorry it took a little long, but I'm sure there's some questions.
I do have some questions, and it pertains, well, first of all, thank you for the information you provided.
Yes, sir.
Here's monies for grants for COVID-19. Do we have any of that that's been resourced by federal government to offset costs for us?
That's a great question. A lot of my groups have been asking that. We're actively looking for those resources for school districts, counties, and cities. If there's monies available from the federal government that potentially will come back to help offset the cost. We just had not too long ago a town hall on that subject matter, and it's actively being pursued because we do know that There are some funds out there. We just need to know who gets them and who qualifies and when they'll be sent out.
All right, that's just one of the areas, because I know there was being grant money is being given to different medical fields, and I know that if we're using that for a particular area, especially for us in our district, since we're self-funded, well, I mean, COVID-19 is an issue that was not promulgated by us, but promulgated by obviously other means. So
Correct.
that's one. And then the other one that I was looking at that was interesting to me was a telemedicine. Being that there are some companies out there that are providing that service at no cost. Obviously, the cost to them would be at the end or the back end, going through a Medicare or some sorts of support, other than the district providing that kind of effort. So telemedicine is probably one of the things we want to look at when it comes to providing services to our employees. I know some of it has been also for students, but I don't know how much of this that we just talked about influences student versus our population that is being served or is paying into member services, so to speak, as you just discussed earlier.
Correct. I think teleservices, whether they're virtual or telephonic, are here to stay regardless of what happens, because it is a lower cost alternative. It's convenient. And especially in a pandemic, people have the option to do it, without being exposed to, unfortunately, if we go to the doctor, you're sitting in a waiting room with other folks that have, may have a virus or some sort, and you don't want that to spread. So we promote telemedicine, teleservices. It wasn't too long ago where providers were not in favor of telemedicine because it was taking, patients away from them. But a lot of the providers during COVID had to go. They themselves purchase software to be able to see folks via virtual or telephonic. And so we will continue to look at the cost. Right now, it's bundled into the Blue Cross cost of the medical. We have some other entities that separate kick it out to a different contracted vendor, because there's a lot of virtual there, and there will continue to be more. But we find that some of the bigger carriers, not always, but some of the bigger carriers do throw this in as a value add for very little. And we want to continue down that road and make sure that we offer it, whether it's with Blue or with whoever the vendor is.
All right, I appreciate that. I just want to make sure that we've, again, go back to the grant funds and COVID-19. I know that a lot of districts have received monies already in that regard. So I want to make sure that we are also can take care of our piece when it comes to the medical side.
Understood, Colonel.
Mr. Arias, good afternoon or good evening.
Yes,
Got a
sir.
question. You mentioned that there's a committee that will be coming together. Do you take part of that along with Mr. Rivera? I've taken Mr. Rivera as our safety risk manager, director. Is that who he is? Okay.
Absolutely, I take part in that.
Okay, can we ensure, I mean, again, the committee obviously is going to hopefully have a good cross-section of our district, but it's very clear that the higher the level and position, the more the salary is going to be as an employee. So I certainly want to be able to see that we have auxiliary, we have paraprofessionals, and professionals in that, because there have been some concerns, and to explain it at the level where they can see the day-to-day activities and find out the pros and cons. Sometimes that information, like the one you just shared with us right now, I mean, obviously, that's something you do on a daily basis. But to them, when you talk about pharmacy and the expenditures, it really is important to get a good feedback from it. For the cross section, in other words, from our district, we would like to be certain that it is equitable as employee payroll. And then the other thing is, I know you mentioned diabetes, and of course, we've known that for years and years. Has there been any dialogue with regard to a wellness program for our district employees and things of that nature?
So I'll address that one first, and then just make some comments on some of the other things you mentioned. But Blue Cross Blue Shield, just like any other health plan, by law has to offer routine annual exams at no cost share, not even a copay. So that includes your annual exams, the blood draws, the PSAs, the colorectal for the gentlemen, the mammograms and the paps for the ladies. If you reach a certain age, you can do the chest X-rays and the EKGs. and that's at no cost. We can educate the district's employees that they have that and that they need to be aware of it. We call it know your numbers because a lot of them don't know. There's probably a good chunk of them that don't even have a primary care doctor. They just pick up the phone and look, whatever's convenient either to work or to home and go. And the other part to that, which really puts teeth into it, which is why I'm working with Blue Cross on some other programs called Livongo, is that once they're diagnosed, now they have to continue to test and buy their strips. And so that's monitored. So if you've got a newly diagnosed or a diagnosed patient that all of a sudden doesn't fill 2-3 months in a row, we see that as a gap in care. And we want to be able to reach out to those folks and ask them what happened. But that's the hard part. You can't make people do that. So we have to look for incentives, and we'll continue to work with that. The other piece that you spoke to on the committees is I do my very best, and sometimes I can get lost, and I'll ask Mr. Rivera to pull me down and put my feet back on the ground. I try not to use any insurance jargon or terminology. I try to do it in layman's terms so that folks, I understand I'm not speaking to people who understand insurance. The only time they use it is when they're in a crisis, and so they may not recall. So I do my very best to do this in layman terms and not to use a lot of insurance jargon. And I'll make sure that I have Mr. Rivera or whoever else on staff to make sure that they kind of flag me in case I tend to go in that direction. But I completely agree with you on that. They have to understand it. I can't talk in insurance terminology or it's going to go right over their head and they're going to lose interest.
Okay, thank you, sir.
Also want to comment, if I can, regarding the wellness program question. That is a priority for both Mr. Rivera, Ms. Campos, our health services director, and myself. So definitely is a priority. With regard to your recommendation, Mr. Castillo, about the good cross-section of representation, 100%, we are in agreement with you and we'll make that a priority. We'll do that.
Thank you. Thank you, sir.
Yeah, excellent, Dr. Sorola. And adding on to what Mr. Castillo said, I think because I'm looking that diabetes was one of the highest medical costs as well as the pharmacy. So I think rather than waiting till people get diabetic, maybe doing preventative, some type of district initiative or something so that we can prevent the people from getting diabetes. I'm more into preventing than once already diabetic. So just a suggestion.
That's a very
good point. That's a good point because those numbers that you saw, those are the folks that know they have it.
Yeah. I just want to say, I'm sorry, Mr. Arias.
That's okay.
That's what Dr. Valdez is saying is a very good point. Actually, we do have some partnership, even starting with our students, believe it or not. We actually, because a lot of our students, they're going to be part of our community, and many of them eventually we want them to come back and work for us. So we do have some partnership actually where we are having some programs to educate them about diabetes and trying to figure out, things to avoid them getting hopefully diabetes. So yes, we do have some partnership, and I know Ms. Campos has been very involved with that. So we're going to continue even expanding on it.
No, on that point, and that's a very good point. But there's one thing that I remember from last year that we discussed, and that was giving stipends to different schools and folks that have programs within the school systems to be able to do a wellness program. And we discussed that last year that something like that was established. So we're giving stipends to individuals to set up programs within schools for the preventive point that we just discussed. So this is a subject that I think we brought up last year, and we didn't get any feedback in return in regards to that. So if we're giving out money for stipends and support that wellness of our folks and the health of our folks, and the programs are out there already, and we're giving money away to make sure we support that effort, then give us some feedback there, I'll just say on that piece, because I know we talked about it, but nothing came back to any of us when we discussed this last year.
So, Mr. Perez, I think if I remember correctly, and I don't want to, because I want to make sure I go back and review all the information. If you allow me, and Dr. Sorola, we can get back to you on that one, because I don't remember all the details. I know also we had it's been COVID, right? So obviously we didn't have the physical education the way we wanted. We didn't have folks exercising and doing so let me get back on you on that one, sir. If you allow me, I'll work with Dr. Sorola and we go back and get you some more information. Either we can email it to all our board members or maybe next board meeting we can present to you.
That'd be awesome, because I know we talked about it, discussed it, we just never sealed anything on that. We know there was an composition plan, and we agreed that we would continue with the plan, because that was one of the areas that we talked about, so
Yes,
not a
sir.
problem.
Yes, sir.
Whenever we get ready. Thanks.
Any other questions from any other board members? No? Okay, thank you, Mr. Arias. That was an excellent presentation with a lot of very valuable data, so thank you very much.
Thank you, ma'am. Y'all have a great evening.
You too. Item number 4, the discussion and possible action to approve contract agreement between Dawn ISD and Resource Navigation LLC. On that one, Dr. Azzi.
So, Dr. Valdez, I know that Mr. Torres has been really working hard with the lawyer from the organization to get the final copy of the contract. Unfortunately, we wanted to get that copy like in a timely manner, so because I want to allow all our board members to review it and have, if they have any question, anything like that. So because of not having enough time, not providing you enough time, I feel like the administration is not going to provide any recommendation at this point. And hoping maybe next board meeting, or if we need to do a special board meeting, I will definitely share with our board members.
Okay, so there will be no action on that item.
Yes.
Okay. Moving on to item number 4, consent agenda. Board members, do you all have any questions on anything on the consent agenda? If not, do I have a motion? Okay, do I have a second? Mr. Colonel? In favor? Okay, Mr. Valdez? Mr. Reina? And I also vote in favor, motion carries. Moving on down to governance. Conservator monthly report for February 2021. Mrs. Romeros?
Yes, good evening, Madam President, members of the board, Dr. Azayiz. The February report under governance, I just want to commend the district. You all are doing an amazing job with the COVID vaccinations. I mean, like Dr. Azayiz mentioned, 90% of your staff is already vaccinated. That's really wonderful. And as of the filing of this report, the February report, there was one campaign finance report that had not been filed, but that has since been prepared and filed as of March. So that is the governance section. Then under the special accreditation investigation, I met with Dr. Sorolla this afternoon, and I would say that most of the activities in his section are pretty much done. There's still some items that are being worked on, but a good part of his information has been provided, and there's noticeable progress in there. And one of the other things that I don't know if you all are aware, but he has moved the safety and risk management department right next door to his area, and that's looking real well. They were settling in. One other thing that he's done is that he's put a kiosk by your reception area so that applicants can actually go in and fill in applications and so forth, and the lady will be able to assist them. So that's another real good thing that he's done. And he's cleaned up his office area very nicely, and you will not see paperwork all over the place or on top of the filing systems or anything. They're really doing an amazing job of cleaning up in that area. On the financial, when Ms. Cancino presented last time, she noted that the district will be able to take advantage of the TEA ADA hold harmless that will generate more revenue for the district. And that's another good thing that you'll be able to take advantage of. On the academic, I did mention that Donna ISD, as most districts, has students failing one or more subjects. However, the district is working very closely and monitoring those students and providing interventions to them. And I believe you also got an academic report that was supposed to have been the workshop that shows you all those results. And then under the conservator directives, Dr. Sorolla is still working and looking at bidding out some software that will streamline their application process. Are there any questions?
Any question? Pardon me?
A tour of Dr. Sorola's.
HR. Right. Any questions from any board member? No? Okay, then we're gonna go ahead and the time is 7:14. And we're gonna be going into executive session as authorized by the Texas Government Code Sections 551.071, 072, 073, 074, 075, 076, 082, 083, and 084. The time is 9:01. We are back in executive order to take action on matters discussed in executive session. Item number 8, discussion and possible action to approve superintendent's recommendation of personnel. Approval of recommendation for professionals to include hiring and termination recommendations. No action on this one. Item B, discussion and possible action to approve to renew Chapter 21 probationary contracts for the 2021-22 school year to include discussion of termination of 4th year of probationary contract if applicable. Do I have a second? Have a second? Mr. Castillo?
Favor.
Mr. Valdez? Mr. Reina? I also vote in favor. Motion carries. Item three, discussion and possible action to approve to renew Chapter 21 term contracts for the 2021-2022 school year. Do I have a motion? Mr. Castillo?
Favor.
Mr. Reyna? I also vote in favor. Motion carries. Okay, which one? On and D, right? Discussion and possible action to approve to renew non-chapter 21 term contracts for the 2021-22 school year. Do I have a motion? Second? Castillo?
Favor.
Mr. Valdez? Mr. Dana? I also vote in favor. Motion carries. Discussion and possible action of level 3 grievance of David A. Garcia.
Make the motion to deny the reading.
Okay, do I have a second? Second? By Mr. Castillo?
Favor.
Mr. Valdez? Mr. Reyna? I also vote in favor. Motion carries. Discussion and possible action of level 3 grievance of Norma Torres, no action. And then F, discussion and possible action to approve pending or contemplating litigation settlement matters and or matters where the professional duty or state board requires private consultation with a school attorney. No action. Do I have a motion to adjourn? Do I have a second? Mr. Castillo?
Favor.
Mr. Reyna? Ms. Watts? I also vote in favor. Motion carries. Meeting adjourned. Thank you and have a great evening.